But okay, today we're talking about the deep abdominals and reconnecting to them, learning about them. I know for me, a lot of these things I say reconnect, and I feel like I was not necessarily connected in the first place. So, um, we're going to be talking about the very basics of the deep abdominals. This will be the main topic of our second session, as the deep abdominal muscles need to work in tandem with, actually, this is our third session. They need to work in tandem with the pelvic floor. So I ordered it in this order because they work together. Especially when we do things like bracing for things like lifting and squatting and pushing and pulling. The role of our deep abdominals and how they change during pregnancy is not very often discussed with people with birthing bodies. And if it is discussed, it's often brought up after pregnancy, which when women are dealing with dysfunction and issues like diastasis or diastasis recti, which some of you may have heard of, and information regarding the strengthening and activation of our deep abdominals during and after pregnancy is really a lot of times met with a lot of fear and misinformation. I know I see a lot of reels and TikTok videos about diastasis, and it's kind of sometimes it can be kind of met with some fear and feelings of like confusion and like, what is this? Why does my belly look like this? Or even shame or guilt, feelings of inadequacy. Again, we have a lot of pressure around our bellies, around how they look and how they are, how they should look according to societal norms. And as we move into postpartum, our bellies are the things that probably change the most, at least from the outside. And so to keep that in mind as we move through this can bring up a lot of feelings around body image, self-confidence, things like that. So keep all of that in mind as we move forward. Be gentle with yourself. First, we're going to go over exactly what are the deep abdominals. I know for many people, they don't even know that there are layers to our abdominal muscles. So we have 3 layers of muscle tissue included in our abdominal muscles. Again, there's going to be a lot of terminology here that you don't necessarily have to know, but I kind of am trying to make it so that you guys have names for things without overwhelming you with a ton of information. Okay, so just let me know if you have any questions. The first layer, the most external layer, the one that's furthest on the outside, is called the external obliques. And as you might be able to see by the picture, hopefully it's large enough for you. These muscles run in a diagonal along the sides of our bodies. So here you can see on this particular image, there's this image is showing you the layers. So you can see there's like this outermost layer, and then they show like a section that's cut out, and you have the second layer, and then the third layer that's here that you can't see very well, but we'll see a better picture of it. You have this most external layer kind of goes in this diagonal direction here. And they support our abdominal viscera, so everything that's in our abdomen. Obviously, they support it because it's right there around the outside. It helps with movement of the trunk, so that upper part of your body, especially in those side-to-side movements. And I know that you may have seen some oblique like crunches where you're kind of crunching to the side. If you've seen those kind of exercises, that's working that muscle in particular. The second or middle layer of the abdominals includes the internal obliques and the rectus abdominis. So you can see in our picture here, this second layer that we're seeing, you have another set of oblique muscles that goes in the opposite direction diagonally. And then you have your rectus abdominis. And we're going to be talking about, the rectus abdominis is what is included when we think of like a six-pack, right? So you can even see that there. That's usually when somebody has a six-pack, that's what you're seeing is their rectus abdominis. And many exercises within the fitness world are really focused on strengthening just this muscle, right? Because it creates this aesthetic, this very aesthetic change in our bodies. And it is that rectus abdominis is connected from the bottom of your ribs down to the top of your pubic bone. So that front part of your pelvis. And it's very much just on the front of your body. This muscle does similar actions as the obliques, where it supports your abdominal organs, and it helps with larger movements like that require more torque, so like crunches. And that's why a lot of fitness programs have a lot of like crunching movements and sit-ups and things like that. That really works that rectus abdominis and leads you to have that kind of six-pack kind of aesthetic that a lot of people are looking for, right? So lastly, the third and the deepest layer, and the layer that we are going to be focusing on the most this week, is the transverse abdominis. You can't see it very well on this particular graphic. There's just a little square of it, but we're going to see it again in a minute. But you will see that the shape is very indicative of its function, which we will also be going over in a second. But in general, this particular muscle differs from the other abdominal muscles in that it plays a big part in maintaining that healthy pressure in the abdomen that we talked about last week, right, with our pelvic floor. So everything is kind of interconnected there. And as much as the diaphragm and pelvic floor are important to maintaining pressure, so is the outside of your can, right, your soda can, the transverse abdominis is all the way around. All right. So we can kind of classify these three layers of muscles into two groups that kind of help us understand a little bit better how they work. The first of those groups are those that often assist in those larger movements and provide that torque that we need to do those big, huge movements. You can, imagine like a crunch. Those muscles often are referred to as global muscles, and those include the obliques and the rectus abdominis, like we just talked about. Those outside muscles, those two outer layers. The second group assists in spinal stabilization and intra-abdominal pressure. The transverse abdominis is part of that group. Okay, and those are usually called local muscles. To work on this group, because it is so focused on stabilization as opposed to like big, huge movements, the exercises that we'll be doing are more focused on abdominal activation while we're keeping our spine still, or in kind of an extended position. And so a lot of the exercises that we'll be doing will look a lot like a plank, or kind of an all-fours position like you're seeing here in this picture with this woman who's pregnant. Even in postpartum, these are extremely helpful because we are transitioning from being pregnant into, kind of reconnecting with our body as it is postpartum. And we need that stabilizing functional strength to rebuild that before we can think about really doing a lot of the work on the more global muscle group, like the rectus abdominis. That usually leads us to do things like crunches or sit-ups or big, heavy lifting. Also, some of the exercises we're going to be doing may involve lying on your back, but keeping that pelvis in that neutral position while using our deep or lower abdominals to move or lift our legs. And in this program, we will be focusing mostly on that local muscle strengthening, so we can create, again, that strong foundation so that if and when you decide to move on to global muscle strengthening, you can do so safely. Plus, that local strengthening is very much involved in our daily movements, like lifting and pushing and pulling and squatting, all the things that are required of us on a daily basis as caregivers, which we do a whole lot of, even like lifting a wiggling toddler, or something that's moving as we're lifting it up. We need to be able to, or even standing and walking for long periods of time, right? We want to be able to do that and have that muscle strength and that muscle endurance to be able to do that without pain. So here's a better picture of our transverse abdominis. It is very much a corset-like shape. Again, thinking about like a can for our abdomen, that's the outside of the can that goes all the way around the outside. It connects from that line of connective tissue in the front, like where your belly button is, all the way up to the top or underneath your ribs, all the way down to your pubic bone. So you can see right here, this line of white tissue. This is connective tissue called the linea alba. It connects from there all the way around to your lower back. You can understand how it assists with that stabilization of the spine because it actually connects there. It also increases the intra-abdominal pressure and assists with expiration or breathing out. So you can imagine it moving inward as you're breathing outward, kind of forcing the pressure into your abdomen and leading to that exhale breath, right? So there's more factors than just your diaphragm moving up and down. We learned about that. There's also your abdominal muscles helping you to exhale. Right? Our body is this really amazing like orchestra of things that are working together all at once. And it can be hard to kind of wrap your mind around that sometimes when we think of like, okay, this muscle does this one thing, this muscle does this one thing, but they don't work in isolation, right? They all work together. You're going to get a better idea of that as we move into bracing and thinking about what bracing looks like. And because it is attached to that lower back muscle, when it is activated, it can cause a little bit of tension in that lower back. So you might, as we do some of these exercises, feel a little bit of tension in your lower back, but you shouldn't be feeling any pain when we do these exercises. So I just want to add that in there, especially some of those exercises where we're on our back and moving our legs in different ways. I don't want you to feel like you have to fight through any lower back pain. You shouldn't be feeling any sharp pains. You may just feel a little bit of tension as you activate your abdominal muscles. Okay, so we want to be safe and listen to our bodies. So one of the most important things you're going to learn is how to brace correctly. Remember when I said that we rarely ever do a pelvic floor contraction in isolation last week? That's, when we think of like Kegels, that is just, hey, Carolyn.
I am sorry, I forgot.
No worries.
Sorry.
You're here. You can always watch the beginning.
Okay.
When we're doing Kegels, that is very much just a pelvic floor contraction, but our pelvic floor works in tandem with our abdominal muscles, with those deep abdominals. So bracing is a combination of the activation of our pelvic floor, like we did last week, along with the deep abdominals. So we went over pelvic floor movement last week with our breathing exercises. Now we're going to add on the deep abdominal portion. And by activating those deep abdominals while contracting the pelvic floor, especially during exercises and movements like jumping and pushing and pulling and lifting and other exercises, we are going to protect our back, and we are also going to maintain a safe intra-abdominal pressure, which prevents injuries and things like hernias, which we talked about before. So to briefly go over it, and you can go ahead and try this with me if you like. On our inhale, we are going to release our pelvic floor, right? Just like last week, and let it drop down and relax as our diaphragm extends downward. And then as we exhale, we gently guide our belly buttons inward to our spine without moving our spine, right? We aren't sucking in as we brace, and there's a difference there. When you suck in, you're inhaling for one, and your ribs are coming out and flaring out, and your spine is moving backward, right? Your spine's kind of, you can imagine like if you wanted to really fit into some tight pants, you're going to inhale and suck in, and your ribs are going to flare out, and your back's going to arch a little bit. We're not sucking in, right? We are exhaling, and we're bringing our belly button gently to our spines. There's a big difference there. Then when those deep abs are activated, we essentially do a Kegel and pull our pelvic floor up. Um, one cue being pulling that tissue out of the tissue box with your vulva, or imagining sucking a blueberry up through your vagina to the top of your head. And I know that's a weird image, and that's a strange thing to think about, but that really helps you to not just, I think with the tissue imagery, that can be more of a gentle, like involuntary movement. Whereas when we're bracing, when we're doing a big movement, we want to really pull our pelvic floor up after we've moved our belly button in. So exhale, brace your belly button in, and then you are going to be lifting that pelvic floor up, actively lifting. And I have a lot more cues, and we're going to go over it in depth this week. So don't worry, we're going to get into detail with it. Okay, and here's a nice little video of what it looks like to not suck in, but rather brace your belly button to your spine. So really quick, it's a quick video and it's very subtle, but you can see how like their ribs and their spine don't move. It's just their belly button going toward their spine. And that is much easier to do when you're exhaling as opposed to inhaling. All right. Okay. So, oh, now it's going to play. Hold on. It's got to play the little thing. All right. Here we go. During pregnancy. So thinking about our transverse abdominis during pregnancy and what happens to it. Our bodies go through huge amounts of muscular changes in order to accommodate a growing baby, which is, this huge transformation that happens over a pretty quick period of time. So our body has to really adjust to what's going on during that time. And one of the big changes is the separation of the abdominal muscles at that linea alba. So at that line of connective tissue that was between the two sides of your abdominal muscles, your deep abdominals, you're going to have a separation there as your baby grows. And that happens to 100% of birthing bodies during pregnancy. So a lot of people think they hear about diastasis recti and they think that it's possible to maintain a closed diastasis during pregnancy and maintain that the entire pregnancy, and it isn't. It has to separate. So every birthing body has a diastasis going into that final stretch of pregnancy there, because it has to in order for the baby to fit, right? For most, that diastasis closes naturally and functionality returns to the abdomen in the postpartum period, usually within about 6 months, I think is typical. But there is a portion of the population for which that diastasis does not heal on its own, and it can lead to pain, feelings of discomfort or dysfunction, or other complications like hernias and prolapse and back pain, or pelvic floor related issues, because that healthy abdominal pressure that we talked about can't be maintained, especially when you're lifting or exerting yourself, which you're doing a lot of in the postpartum period, right? So something that you may have noticed in your own body, whether or not you have like an active diastasis at this point, even years postpartum, you may notice a doming of the abdomen or a soft spot kind of down the center of your belly from the top of your, or the bottom of your ribs to below your belly button, all the way down to your pubic bone, right? And you may notice that doming when you do things like try to sit up, or maybe like lift your legs up if you're, I don't know when you would do this, like if you're holding onto something and then lifting your legs up, or exerting yourself heavily in your abdominal area, you might notice like you have your abdominal muscles, and then right in the middle where your belly button is, you have a little like soft pooch that kind of comes out in that area. Or you may have just noticed some pain or weakness in that area when you're sitting up or lifting or other related movements. This may be a diastasis, or it may be that you just need to learn how to lift in a way that activates those deep abdominal muscles and helps you maintain that proper pressure in your abdomen as you do those particular movements. So the only way to really know whether or not you have a diastasis that's affecting you greatly and affecting your functionality is to go to a pelvic floor physical therapist and get diagnosed. There are a lot of videos out there of how to self test for diastasis, and I would highly recommend that you go and get a professional to do it, because self-testing isn't super accurate. And there are a lot of studies that are being done actually like right now about that it's kind of changing the way that we're thinking about diastasis. And so a lot of these videos are very simple and they kind of can scare you. You can go to test yourself and then you're like, oh no, I have this huge diastasis and it's real, like it's really big. And really, they're finding that the way that things have been measured in the past isn't necessarily accurate to how functional you are and how much, you really need intervention. And with that being said, for a lot of us, so first, this is a really neat picture of kind of what a diastasis can look like. So if you imagine like after postpartum, you're during pregnancy, your diastasis kind of looks like this, where it's really extended and it's making room for the baby in there. So it pulls, you get this separation between your abdominal muscles. And then postpartum, when you don't, it technically what should happen is it closes and you have a smaller area here. But sometimes it doesn't, and you maintain this kind of extended area here. And again, it's really, we want the ultimate goal is functionality in our abdominal muscles and being able to lift and do things without pain and feel strong while we do it. And with that being said, for a lot of us, there are a lot of feelings and emotions, again, and body confidence related stuff around our bellies. Our bodies have made these amazing transformations so that we can house our babies in our abdomens. And then afterwards, we get faced with all these pressures from everywhere to revert that transformation as quickly as possible and get it looking flat or toned or like we had never been pregnant to begin with. And while I'm not saying having an aesthetic goal is inherently bad, that is solely up to you and whatever you feel comfortable with within your own body. I recognize that culturally and socially, there is so much pressure around, like specifically related to the way our stomachs look. Even just a quick glance on social media leads you to a lot of videos and images of women showing before and after, specifically of just their stomachs after pregnancy, right? Like that is what they're showing you. And we put so much pressure on our stomachs, especially when they already do so much for us. So I'll really be encouraging you this week to explore your relationship with your belly before and after pregnancy. I know we've done that already a little bit. Diastasis recti is really complex, and a lot of studies are still being done to determine what is actually normal in the postpartum body. And while in the past, a lot of information has been around the width of the diastasis. So this is kind of what I was talking about, is a lot of times when they tell you to self-test, you're testing how many finger widths distance your diastasis is. What they're finding now is not only is the width important, but the depth is also important. And also, something that is extremely important is how capable you are of activating your transverse abdominis and your pelvic floor. So my advice is, if you do have a concern, you can reach out to me. We can talk about it a little bit, but I definitely recommend that you go see a pelvic floor specialist. We are going to focus on how to activate our transverse abdominis in tandem with the pelvic floor so that we can get tension in that linea alba. So even if you have that separation, you're going to learn how to get tension there and have functionality in that area. And it should help you feel more functional, more comfortable with everyday tasks. And we will be moving slowly with this part of our bodies, because even if you aren't really close to postpartum, you're not very early in your postpartum, it is still a really good chance to slow down and explore what it feels like to activate that part of your body. And a lot of us still have kind of underlying things that are left from pregnancy, even years postpartum. I've had a few clients that are perimenopausal and they still have a lot of symptoms from a diastasis that they have been dealing with since pregnancy, decades previous. So it's definitely something that can be looked at for years past. One thing I also want to mention in regards to this particular muscle group are the roles of the hip flexors and how they affect our ability to really activate our pelvic floor and our abdominal muscles. And while our hip flexors are really, really important because they help us do larger movements like moving our spine from side to side and flexing our hip, obviously, they also often take over for a lot of the stabilizing roles when our abdominal muscles, our pelvic floor, and our glutes kind of check out, which is why we've been releasing them the last week or so. So the hip flexors have connection points along the lower back and the diaphragm and throughout the pelvic region, like all through your pelvis, all the way down to your femur. And when we rely on them for stabilizing purposes, so like just to stand or to sit, if we are holding on with our hip flexors, they often get overly tight, which can hinder a lot of the proper function we need from your diaphragm and your abdominal muscles and your pelvic floor, which make it really hard to take full functional breaths and to really activate those muscles. The psoas and the quadratus lumborum, or the QL is what I call it. A lot of the times when we do our releases, are two of those hip flexors that have connection points along the diaphragm. As you can see in the picture here, you think like hip flexors, they're down by my hips, like down here. They move all the way up your lower back and can connect all the way up to your diaphragm, up into the middle of your back. So they go up higher than you think, and they affect more than you think. So before and after doing our strengthening exercises, just like we've been doing all last week, we'll work on releasing our hip flexors first, just to give those stabilizing muscles a chance to actually start working and doing their job without as much assistance from the hip flexors, right? And one way to think about it, my little thing here, is you have your pelvis here, and you have your hip flexors that are kind of connected to this front part of your pelvis. And then they will go up the back as well, as we see in the picture. But you can imagine kind of your hip flexors trying to hold on here real tight. So you got, instead of activating your abdominal area here to kind of hold your pelvis in this upright position and your glutes to hold on right here, you're relying on your hip flexors, which are here. And you can imagine like almost like a muscle that is like this, right? Like two little fingers kind of holding on to your pelvis, instead of like your glutes that are these big, awesome, really strong muscles holding on here, and your big abdominal muscles right here doing their job. You have these little muscles that are like, all right, I'm trying to keep her up, I'm trying to hold on. And so they get nice and tight because they're doing that job that they shouldn't really be doing. They're more for those big, short movements, and you're using them for long-term endurance movements, and they're getting tired. All right. So what about crunches and planks? Are those bad? One, we won't be doing many like actual crunches in our exercises. And then two, the planks that we'll be doing are we will be doing in a very specific way, and I'll be guiding you through them. And a lot of times people with diastasis hear that they should not be doing planks. The answer to this question, are they bad, is no. Crunches and planks are not necessarily bad, but crunches largely work that rectus abdominis, which is part of that global muscle group, those big movements, which we discussed earlier. And we really want to focus first on that transverse abdominis in order to, again, to establish that foundational strength, work those deep abs. And we're really thinking about stabilizing muscles and getting a really good handle on our abdominal pressure and how to kind of adjust that as we do the things we need to do. That's what's going to keep us strong and stable. And that's especially when we do the things we do every day. In the past, planks have been something that have been advised against, again, with people with diastasis, but that was often due to planks being done in a way that may have been detrimental to that area. So I'm gonna guide you through how to do them in a way that is safe, and that is using your breath and proper bracing, and also working with you on how to modify them so you can progress slowly and gain confidence in your core activation, and using your shoulders and your shoulder blades in a correct way so that you're not causing injury. So don't be scared of planks. They're going to be fun. All right, so really quickly, let's try activating our transverse abdominis just right here. We did it a little bit. Let's try it again, and I'll give you some extra cues, and we're going to be doing this a lot this week. So I'm just going to throw these cues out to you so that they're familiar to you as we work on them. So first, I want you to inhale and relax everything. And then when you exhale, I want you to gently tack your belly button to your spine without flaring your ribs or sucking in. So I like to think of like a little thumbtack, your belly button, and you are gently just pushing that thumbtack into your spine. Okay, so it's a little more than 5%. We're not at 5% anymore. We're maybe at like 20% right now. All right, so inhale, relax. Exhale, tack your belly button. Now I want you to close your urethral opening. So that's like stopping the stream of urine, right? Like you're peeing and you want to stop. So you're inhaling, relaxing, exhaling, belly button to spine, stop that pee. Okay, and now probably the hardest part for a lot of people is actually pulling that pelvic floor upward. And some cues for you are imagining sucking something up your vagina. So like a blueberry, like you have a straw from your vagina all the way up to the top of your head, and you're trying to suck it up all the way to the top of your head. You can also imagine your urethral opening or your pee hole kind of shooting up to the top of your head. You can also imagine your two hip bones here. You can imagine pulling them together. So like if you had a force that was just pulling on them to bring them together, like you had two, and you're using your abdominal muscles to pull them together. And then you can also imagine that area right under your, where your underwear band is, smiling, right? Like your uterus smiling. So this area right here, doing a big smile. Can't do this with two hands. I need 4 hands. Big smile in that area. Yeah. So those are all some cues that you might be able to try as we do this. And we're going to practice in just a minute here. Last thing, again, I know I've said this already. If you're saying to yourself, I don't get it, I don't know what you're saying, don't worry. You're learning a new thing. Stay curious. Keep visualizing. Try those cues. You can always think of new ones, come up with some more that help you out. Keep asking questions about your body. Stay curious. I know it can get frustrating, but keep trying. We're going to get there. And learning these things there are layers. There's a journey associated with this. So even myself, who has been doing this for a little while, I still find myself learning new things about my body. And I like to think that that's like a lifelong journey. So keep that in mind. You're never going to get to a place where you're like, got it, figured my body out, all good. It's constantly changing, and there's always something new to learn. All right. So with that being said, let me stop sharing here, and I'm going to switch over. But first, because we're going to do a quick 15-minute workout. We're going up to 15 minutes. All right. So find some space. Before we do that, I do want to say for this week, I'm going to try something a little new with you guys with some of the movements. And I know I didn't tell you previously to have this equipment ready, but really all you need, I'm going to try to work with, and you don't need it for today, is that bolster or that pillow, and something that you can place under your hips while we do some of these exercises that you lay on your back. And what that's going to do is, as you lay on your back, a lot of times what ends up happening is you go on your back and your pelvis ends up tilting up or tilting down. And like we end up tilting it too far in either direction. And so by having a support surface here underneath your tailbone, you're kind of keeping that pelvis in a neutral position. And we need that in order to use our stabilizing muscles correctly. So it might be hard to find something that's like the right consistency, but I'll show you a couple of examples of what I have after our exercises today. The workouts are going to get a little more active. Really, it's pretty low. It's very low impact still. So wear comfortable clothing. I don't want that to be a barrier for you. You can work out in anything and modify as needed. But just, don't be trying to, like, it might be hard to get up and down off the ground if you're wearing a really tight skirt or really tight pants. But don't let that stop you from coming to the workouts or doing the workouts, because I know that can be a barrier sometimes. You don't need a lot of space, but we will be lying down some and getting up. So have a little space around you, kick the toys out of the way, and make a little space for yourself. And just a reminder that in order to keep these workouts within 15 minutes, sometimes I move a little bit quickly. You can always revisit, and that can be really difficult as you learn these things, but it's going to get easier. We're going to repeat the exercises multiple times throughout the program. We're going to do all of them again, so you'll get better at them. And again, remember that you're learning. It might be a little frustrating or confusing at first, but you'll get there. And then we'll be learning how to plank. So this can be intimidating for some people. I like to think I have a little bit of a different approach to teaching them. So even if you feel like you know how to do them, have an open mind coming to our plank 101 session, which will be later this week. Let me know, reach out if you feel like you need modifications in the plank position, like you have wrist pain or shoulder pain or something that's really bothering you. We want to find exercises that are right for your body. Okay. All right. I'm going to switch over. A lot of talking, but give me 1 second. Cool. All righty then. Here we go. So today you are going to need your strap. So grab your strap. You're going to need your ball. And that's it. Strap and ball. Okay. And I lost my ball. That's one of those things that always runs away from me. All right, so to begin with, we're going to do our hip flexor release. So have your ball, and we're going to release our hip flexors first. We've done that before. All right, so we're going to come down onto the ground. I'm going to start my timer. And you're going to put your ball, remember, here, I'll do it this way, to put it on the outer part of your hip. Don't go into your groin. You're going to roll up and down along the side of your hip there, kind of kick your other leg out to the side to support you. Find any tense areas and just melt down around the ball. I know this particular release, finding a spot can be tricky. And that's something that we can talk about in your one-on-one sessions. If you're really having any issues finding things in these exercises, we can definitely go over those as needed. Deep breath. Good. Go ahead and switch to the other side. Find that tight spot. And you can either rock back and forth over it, kind of cross across where that tightness is. or you can just melt down around it. Take a deep breath, try to relax. It doesn't help if you're really tense. That tends to cause more tension. So make sure you relax. And after this, we're going to go into that QL release, which is on your back, and I'll let you know when we switch. We're going to be going over that bracing again in an all fours position today. All right, go ahead and roll onto your back. So come from your side, roll onto your back, put that ball below that last rib and roll back and forth. Find any tense spots that you can. Try to relax. Remember that last rib is probably lower down than you think. This is releasing those hip flexors that we saw in that picture that are just connected right down to that, or right up to your, right below your diaphragm. Deep breath, relax down, melt down around it. Remember to lift up your hips. That gives it a little more pressure on the ball. Deep breath. Good. Go ahead and switch to the other side. And I always find that my left side is always tighter than my right. And for some people, I feel like it's the opposite of like the side that we tend to carry things. I don't know. It's hard to say though. I don't think that's always true. But I hope for some of you that experience some of that back pain, this even just releasing these areas is helpful. Deep breath. But then once we get into strengthening, hopefully that leads to less pain on a consistent basis. After this, you're going to get into that all fours position. So go ahead and pull that ball out from under you. You can set it off to the side. You don't need it anymore. You're going to come into an all fours position with on your forearms, okay? And you're going to sit back into your hips a little bit. So just gently, slightly kind of move back into your hips. Kind of stick your butt out behind you. Relax in this position. And you're going to take a deep breath in and relax that pelvic floor. And then as you exhale, I want you to imagine that gentle tack to the belly button. And then inhale, relax again. Exhale, gentle tack to the belly button. See if you can lengthen your spine here, especially in your mid-back area, right behind your ribs. See if you can just lengthen that, keep your ribs down, and spread your sternum away from your ribs. Inhale, relax. Exhale, gently tack that belly button to your spine. All right, on the next one, we're going to stop that stream of urine. All right, so inhale, relax. Exhale, nice long exhale, belly button to spine. Stop that stream of urine, and that's it. No sucking of the blueberry or anything yet. We're only stopping the stream of urine. Inhale, relax. Exhale, belly button to spine. Stop that stream of urine. We do everything at about 20%. Inhale, relax. Exhale, belly button to spine. Stop that stream of urine. Good. Okay, now we're going to try that sucking up of the blueberry, okay? So inhale. Exhale, brace that belly button. Blink that pee hole. or stop that stream, and then suck that blueberry all the way up to the top of your head. I'm going to give you a few different cues, okay? Keep going with me. Inhale, relax your belly, relax your pelvic floor, lengthen that spine. Exhale, brace the belly button. I'll be saying blink the pee hole or stop that stream. And then pull those hip bones together with your lower abdominal muscles. Imagine pulling those hip bones together. Inhale, relax. Exhale, brace belly button. Blink the pee hole. And rocket that pee hole all the way to the top of your head. Good job. All right, now come up onto your hands here. So you're in like a cat-cow position. And we're going to try some movement with that brace. All right, so you're in a cat-cow position. You're going to inhale, relax. Exhale, brace the belly button. Blink the pee hole. Rocket it to the top of your head. And then lift up that right arm and reach it out in front of you. Reach, 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 like someone's standing in front of you and you're going to grab them. And then inhale, relax, bring that arm down. We're going to do the same thing with the left arm. Exhale, brace, blink, rocket, reach with the left hand. Reach, reach, reach. Bring that arm right to the side of your head. Good. Try again. Exhale, brace, blink, rocket. Keep those ribs down. Lengthen your spine, especially behind your ribs. Reach that arm. Reach, reach, reach. Everything is long. Everything is extended. Inhale, relax. Exhale, brace, blink, rocket. Reach your spine. Reach that arm straight out. Good. And relax. Take a second, roll out your wrists, shake it out. I know that can be tough on the wrists a little bit being in that position, but we're going to get back down into it, okay? All right. So come back down into that all fours. This time, I'm going to have you lift up your knee, okay? So it doesn't have to be a big, giant movement. We're just lifting our knee up a couple of inches off the ground. And we're going to use that brace in order to keep our hips even. I don't want you to like lift and like dip your hips off to the side. Okay, I want you to imagine you have a teacup right here on your hips and you don't want to tip it over. Okay, so we're going to inhale, relax that belly button down, relax that pelvic floor. Exhale, brace, blink, rocket all the way to the top, and then lift that knee up off the ground. And then inhale, you relax it down. Exhale, brace, blink, rocket all the way to the top of your head. Keep those ribs down, lengthen your spine, lift that left knee up off the ground. And then inhale, relax. One more time. Exhale, brace, blink, rocket it all the way to the top. Suck up that blueberry. Lift that knee up off the ground. Inhale, relax. Exhale, brace, blink, rocket that knee up. Inhale down. Good. All right. Now we're going to come onto our backs. So roll onto your back. And you're going to bend your right knee and straighten your left knee, okay? Right knee bent, left leg straight. You're going to take your left hand and you're going to put it right on the small of your back. So you're going to kind of slide it underneath you so that you don't push your back into the ground. I want you to kind of maintain that neutral posture in your pelvis by keeping your hand behind you. Your other hand is going to go behind your head. All right. And this is called the McGill crunch. So we're not actually crunching. We are just brace blink rocketing in this position, okay? And I want you to really focus on how, keeping your ribs down. Okay, so inhale, relax everything. Let your belly expand. Exhale, brace that belly button to your spine. Blink your pee hole and rocket it up to the top of your head. Imagine that rocket going up underneath your ribs that are being laced down, staying down. Inhale, so you're not crunching up, you're just staying down on the ground. Exhale, brace, blink, rocket all the way up to the top of your head. Good. Now on this next one, I want you to imagine lengthening your spine from the middle of your back all the way up to the top of your head. So nice and long as you rock it, okay? So inhale, relax, exhale, brace, blink, rock it, keep those ribs down, and imagine almost like your head is turtling out, like you're a turtle and you're stretching your neck out from the back. One last one. Inhale, relax. Exhale, brace, blink, rock it, and extend that neck out from the back like you're a turtle. There's not much movement going on here at all. It's okay. I know it's weird. Good. Now switch to the other side. So your left leg is bent, right leg is straight. You're going to take your right hand, put it behind you, underneath you, under your back, left hand behind your neck or behind your head. You're going to inhale, relax, exhale, brace, blink, rock it all the way up to the top of your head. Imagine lengthening your neck, lengthening your mid-back while keeping your ribs down. Now inhale, relax, exhale, brace, blink, rock it all the way to the top of your head. Good. Now on this one, I want you to think about your breath and extending your breath for the time that you're brace, blink, rocketing. Okay, so one thing that can help is imagining you're blowing out of a straw. So make that little O with your mouth. And you're going to inhale, relax everything, make that little O with your mouth, and you're going to blow out a nice long breath. Exhale, brace, blink, rock it, extend, and then when you're ready to inhale, relax everything. Exhale through the straw, brace, blink, rock it, rock it, rock it. Good. Last one. Inhale, relax. Exhale, brace, blink, rock it, rock it, rock it. Keep those ribs down. Good. Now inhale and relax and come on up. Come on up to standing. We're going to do a quick hip flexor stretch just to do one last stretch before we go. So put your left foot in front, right foot back, and you're going to reach your arm all the way up to your right arm, all the way up to the sky. Left leg's forward, right leg's back, left arm is up, and you're going to reach back behind you, kind of pat yourself on the back here, and do a very small extension back. So like a tiny, tiny back bend to get a nice deep stretch all along the front part of your body here. Make sure your hips are both facing forward. Deep breath. Good job. I know that was weird. I hope you were able to kind of get curious with your body there. Go ahead and switch legs. We're gonna do the same on the opposite side. Last thing, we're gonna be doing a lot more movements with that. So we're just getting familiar with that brace, blink, rocket, and that's what I will be saying. Make sure you attach whatever cues work best for you. But that is what I'll be saying as we do that bracing movement, because that's just easier for me to say. But if you have any questions, all right, shake it out. Make sure you reach out. Make sure you put any questions out on the group. Feel free to even say like, I don't get this at all. This is so weird. This is so frustrating. because I'm sure that there may be others that are feeling the same way. Don't be afraid to share in that with other people. This can be very different. So tomorrow we'll be seeing each other at 8. And yeah, good job. I hope that was informative, and I hope you have a wonderful Sunday night and a wonderful Monday. I'll be here for a few minutes if you have any questions. Otherwise, I'll see you tomorrow.
I did have one question.
Yeah, Sarah.
So when I am doing that, I know I'm not literally clenching my glutes. Like, I know the difference between that, but it does feel like almost my sacrum is sort of coming in a little bit. Is that part of the movement too, or should I try to separate that piece out a little bit if I can?
Almost like does it feel almost like your your anus area is contracting, or is it actually like your okay.
Yeah.
I would say if you can't, you can kind of work on that a little bit to try to isolate like a little bit more forward. But honestly, it will feel you're going to feel it further back as well. So as long as like the majority of your like pulling up motion is felt kind of more around like the perineum and the vaginal area, I think you're good. And honestly, like the more we do it, you'll find your body, the way you feel it, and the way your body responds might change. And so yeah, keep it up. It sounds like you're doing good stuff.
Yeah, thank you. Definitely, those little tiny muscles that you're like, oh yeah, there's something there. So.
Yeah, for sure. And a lot of these movements will be like super duper subtle, and so it'll be hard to like sometimes you're like, I don't know if I'm doing this correctly, but and when you might actually find that like the next day you'll be like a little sore in areas or like feel it a little bit, and you're like, wow, that we didn't do very much, but I feel it. And so we are doing a lot of work with those stabilizing muscles that kind of work at that low level.
Cool. Thank you so much.
Yeah. Have a good night.
You too. Bye.